Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight, we're talking about getting ready for equine breeding season. If you've joined us, you're probably considering breeding a mare this year, or maybe you're an experienced breeder with years of raising foals behind you, or perhaps this is the first time you've bred a mare. Either way, breeding and raising your own foal is an exciting and rewarding experience, but at times it can also be challenging. You're in luck. We're joined tonight by a board-certified equine reproduction specialist, Dr. Ryan Ferris, who's here to answer your questions. Dr. Ferris runs Summit Equine in Newberg, Oregon, with his wife, Dr. Dora Ferris, and where they offer reproductive and sports medicine services. Prior to moving to Oregon last year, Dr. Ferris was at Colorado State University's Equine Reproduction Laboratory. Welcome, Dr. Ferris.
Thank you, Michelle, and to the horse for asking me to be on tonight. I'm excited to hopefully provide a little bit of education and a little humor maybe tonight.
Yeah. Can you tell us a little bit, Dr. Ferris, about your interest in this specialty?
Sure. If I had a primary interest, it's really in mare subfertility. And, when I was at Colorado State University, I had a pretty active research program going really in infectious endometritis and trying to figure out why mares develop infections, especially chronic infections, and how best to treat them and overcome those infections. So I guess if I had a specialty or an area of passion, it's really the subfertile mare and trying to figure out how to get more embryos and more offspring from those mares.
Okay. Well, I want to give everyone who's listening live a quick review of our Ask the Horse live format. We're going to be starting with questions that everyone submitted during registration. If you're listening live, though, you can ask questions via the chat. If there's something that comes up that you'd like a clarification on, or if you have a question that you'd like to submit live, we invite you to do that. And we're going to do our best to get to as many of your live questions as possible, as well as ones that we have set aside from registration. So don't be shy, go ahead and send in your questions. And with that, we're going to go ahead and dive right in. I want to start with these first two questions, Dr. Ferris, that have to do with industry and becoming involved in equine reproduction. We have Raina, who's in Vermont, and she wants to know, what is the best path for becoming a foaling attendant or a mare and foal handler?
Yeah, it's a great question. A lot of people get started, depending on their background and stuff, doing an internship at a large breeding farm. And that's going to get them a chance to get exposed to a lot of foalings and how to handle foals and take care of foals. There's also some great internships in Lexington, Kentucky on the thoroughbred studs. I know the University of Kentucky organizes a lot of those internships available for students. They're usually from roughly January to May, June-ish, about a 6-month time period. And, really that gets you your feet wet, gets you a lot of training and a lot of exposure. And then from there, it'd be pretty easy to submit your resume to a lot of breeding farms and feel pretty comfortable with your capabilities and your background after spending such a 6-month intensive period foaling mares and being around foals.
So do you recommend like an equine science degree and getting into one of those programs, or is it something that you can step into as a trade without going to school?
Yeah, I think there's both options. Some of those internships are as part of a formal 4-year degree, but a lot of them, you don't necessarily need to have a 4-year degree and potentially could just step into those positions and look at it as a career path for you.
And our next question is related. Joseph is in Louisiana, and he wants to know what are some major things an extern or new graduate should have as a fundamental knowledge before visiting or joining a reproduction clinic.
Yeah, it's another great question here of, trying to figure out, it's always a little intimidating going to a place and being expected to know things. And, if I was to give you any advice, Joseph, it's to have a great attitude and jump in and be involved while you're there. That's what a lot of places are going to be looking for and can get you the training and education. If you wanted to brush up on something for joining a repro clinic, I would say really having a good knowledge of the normal mare's estrus cycle of what happens, how do they grow follicles, how does ovulation work, this formation of the CL and rise in progesterone, and just sort of the normal cycle. If you understand the normal cycle, then it's pretty easy to plug you in and explain all the hormone therapy and what's going on during the times of breeding and things like that.
And I think that segues into our next question, which we're going to dive into our practical questions with breeding. Amy in Nevada said that she's never bred a mare before, but is considering breeding a mare this year. What are the steps involved in selecting a stallion and getting your mare in foal?
Yeah, So with this, the first question that you need to answer is, when do you want your foal born? Which there's several aspects of that question. And so part of it is, does your breed or the industry that you're looking to, that your horse is in, does it have a time of year to typically have those foals born? So I'll give you an example here. Racing quarter horses, cutting and reining type mares oftentimes want early foals, January, February, March-ish time frame, as compared to warm blood breeds for dressage and jumping. Oftentimes they don't start breeding and have foals born till April, May, and June. So some of that will depend on what industry you're in. And then that also brings up the aspect, if you're going to have an early foal, if you want to breed your mare in February, March, or so, you may have to get her to cycle earlier. The normal physiological breeding season for the mare isn't going to start till roughly May 1st. So with that, if you want to start breeding her in February, you're going to have to put her under light. And with that, we give them an artificial photo period. So we have 18 hours of light and 6 hours of darkness. And so for us here in Oregon, where it's just starting to get dark here at 5 o'clock, the lights came on about 45 minutes ago, and they'll go off tonight at 11 p.m. And so that'll give them that 18 hours of light and 6 hours of darkness. And that works pretty well to get mares to cycle earlier in the season to allow you to have that early foal. Along with that, you need to start thinking of picking a stallion, in which case there's tons of options available to you, and trying to figure out what stallion is going to match up best with your mare. And then from the veterinary aspect, I always try to think of what kind of semen are you going to get? Is that going to be fresh semen, cooled semen, where the stallion might live? For me in Oregon here, the stallion might live in Texas, and they're going to collect the stallion in Texas, package it up, cool the semen down, and then mail it to me via FedEx for arrival, or frozen semen, which allows you a lot of opportunities as well. With frozen semen, this could be a stallion that unfortunately may have deceased, or potentially allows us to access stallions from other countries such as Europe. That semen can be imported and then made available, where you can have a foal here from a stallion that lives in Holland. Now, with that, there's some changes in expectations. When we think about fresh semen, usually we talk about a 60-70% per cycle conception rate, which means that if we bred 100 mares with fresh semen, we'd expect 60 to 70 of them to get pregnant. When we go to cooled semen, that pregnancy rate's going to drop a little bit, 55-60% with cooled semen on average. And then with frozen semen, it's going to drop a little bit more, 35 to 40% per cycle conception rate. So, from a reproductive standpoint, from my end, when clients are picking stallions and whatnot, I would say cooled semen is much more common than fresh out there. And, if there's a stallion that's available for cooled semen, usually things are going to be a little bit easier than trying to go the frozen semen route. But with frozen semen, I also understand that, certain genetics are only available. For instance, if you're trying to breed from a stallion in Holland, the only way we're going to get semen from that stallion is to breed with frozen semen.
So, Dr. Ferris, you mentioned something about the mare cycling and using the lights to help induce that early. Mm-hmm. So I'm in Oregon as well. I'm about 3 hours from you. We're getting dark about the same time. But we just had the solstice and on the 21st, and I swear the next day my mares were acting like they were starting to cycle. So am I imagining it, or am I just blaming all my problems on my mare's heat cycles?
It's a great question. With that, there's a couple aspects that could be going on. One, here in Oregon, we have a relatively mild climate. And sometimes that can allow mares to cycle a little bit more year round. Definitely when you get down in Texas and Florida areas, a lot of those mares may cycle year round as compared to being in a colder climate like Colorado. The other thing that could be going on is that your mare may be starting to think about cycling. And with that period, so mares go through 4 kind of phases throughout the season. Usually in November and December, they're in a period called anestrus, where they're not really cycling. And then they go through a period that's called transition for about 60 days. And with that, the ovaries are kind of firing back up from being in anestrus and being shut down. And during that time period, they grow follicles, but they don't actually ovulate. So because of that time period, these mares may show like they're in heat, but they're not actually cycling yet. And then usually after that 60-day transition period, they start cycling normally, ovulating every 21 days, and they'll do that through about October, in which case then they'll go into a fall transition period as well and start shutting down for the season.
Okay. So it might not be my imagination. It might be that we're starting a transition phase.
We might just be starting a transition phase. The other thing for light therapy, not that I get any funding from them, but they make a blue light mask as well. So if you don't have the capabilities to put your mares under lights in the stalls, they actually do make a nice little mask that's battery powered, and it comes on at dusk and stays on till 11 o'clock at night. And that can work very well for inducing cyclicity in mares as well.
And I think that's a nice segue into our first live question. We have, let's see here, it's Jill. She says that she is an experienced breeder and is experienced with foaling, but that she bred her first thoroughbreds this last year. Late January due dates seemed like a great idea until the temperatures dropped. She wants to know what she should do differently when foaling a mare in winter. So on the other side of this, so if you breed early, you're going to be foaling early. What can Jill do to prepare for those foals that are coming soon?
Yeah, so it's always a little problematic, and we definitely faced this when I was in Colorado, where it would be sometimes below freezing till March or April at night, and that's when most of our mares are going to foal. So if you could do a couple things. One, having some nice towels available after foaling to help dry that foal off. Really the first, once that foal is dry, they can actually maintain their body temperature pretty well, but getting them dry initially is going to be the best thing. Having some sort of heat source, such as a heat lamp available for that first 24-hour period, just to get that foal nice and warm. You do have to be careful of having fires, and obviously we have straw and shavings around these mares at the time of foaling, so just be careful if you're going to use some sort of heat lamp or infrared type heater to have a nice little warm spot for that foal. That fire safety is definitely addressed as well. And then really once that foal is beyond 24 hours of age, as long as it can stay dry, they actually do really well. In Colorado, we would oftentimes, they make these cute little foal blankets, and we would oftentimes put a blanket on those foals for the first couple weeks of life, just to help keep them a little bit warmer. But as long as you can keep them dry and keep them out of the wind, they actually do really well.
We have another question from our live audience. This is from Mia, and this was a question that we actually got several forms of this question during registration as well. She wants to know how old is too old to breed a mare for the first time. She said she just retired her 17-year-old show mare, and she'd love to have a foal from her, but she's concerned she might be too old. So what are the likelihoods that that Mia's going to get her mare in foal, and then what are some options to help her get in foal, or options to get a viable foal from that mare?
So it's a little bit of a complicated question. So I'm going to talk about just there's age-related effects, and then just some physiological effects or pathological effects that happen to mares as as they age, even if they've never had a foal. And so first off, just to start with normal background, mare peak fertility happens in mares about 4 years of age and then stays pretty high till about 15. At about 15, it starts to go down a little bit. And then at 20, it really starts to go down again. Now, that doesn't mean that we can't get pregnancies out of these mares, but it just becomes more difficult. So she's kind of in that early teen range where, you know, things are going to start becoming a little more difficult just because of an age-related event. And the reason for that is that the mare forms all of her oocytes on her ovary. So every egg that she's going to have for her lifetime, she formed in utero. And so those eggs have been sitting there for this example, 17 years and a few months, because they're older than she is actually. And so with that, those cells have undergone some changes, and so we do see that it's a little more difficult to get older mares pregnant, and they do have a slightly higher rate of early embryonic loss as compared to a young mare. But that doesn't mean that she can't have a foal. Now, the other complication with a mare that's 17 that's never had a foal before, a topic that we could spend the next hour talking about, is the older maiden mare. And with this, we're not exactly certain of the physiology behind this, but essentially what happens is if these mares haven't had a foal, by the time they're 15 years of age and older, their cervix quits relaxing when they're in heat. And while we can get an AI pipette through their cervix and get them inseminated, there's a natural inflammatory response every time you breed a mare, whether it's with fresh, cooled, or frozen semen. And because that cervix stays closed and doesn't relax like a younger mare's cervix would, they can't clear that inflammatory fluid from their uterus. So I would expect that mare would need maybe a uterine lavage following breeding, and probably be put on some sort of ecbolic agent or some sort of agent to help enhance uterine contractions to help clear that fluid. And I kind of find with these older maiden mares that about, 30 to 40% of them come in and they're relatively straightforward. Maybe need a lavage, some drugs to help cause uterine contractions to help clear that fluid, and they do really well and have a great pregnancy rate. About another group, 30 to 40%, are relatively easy, as well, but take a little bit more work, maybe a couple of lavages in there to get them kind of cleaned up and to support a pregnancy. And then there is a population of mares, 10 to 20%, that no matter what we do, we're never able to get that fluid to completely clear from their uterus, and it becomes extremely difficult to get pregnancies from them. And then the only real option at that point is to do something like in vitro fertilization or ICSI to try to collect oocytes from that mare to generate offspring.
So in that option, then, would you use another mare to carry that foal to term, or would you use the original mare that you collected from?
Yeah, so if we were to do in vitro fertilization and ICSI, usually we would use a surrogate mare just because of this mare's age and whatnot. Even though she's never carried a foal, every time she goes through a cycle, there's a little bit of inflammation that actually happens in their uterus. So sometimes there's even just a little bit of fibrosis in those mares' uterus after 17 years of just normal aging events. And so I probably would recommend that if you were to go to that step, that you would use a surrogate or a recipient mare to help carry that foal for you. But, there's a lot of 17-year-old mares that are maiden mares that come in that we're very successful with. So just because she's 17 and hasn't carried a foal, I think, getting a good veterinary exam done on her, and to be honest, no one's really able to predict how well she's going to do till that first cycle, and then kind of see how things go from there. And so once we inseminate her and see how much fluid she's going to retain post-breeding and how easy that fluid is to treat and get cleared up, that'll really be the question of if she's not pregnant on the first cycle, do we try additional cycles or not?
And so if Mia's mare at 17 is able to get in full, is there a higher risk for her pregnancy or her delivery because of her age and the fact that she hasn't foaled before?
So just because of her age, there's a little bit higher rate of embryonic loss. So you're going to see a higher rate of embryonic loss. So she might get initially pregnant at 14 days, but there's a higher rate of embryonic loss through 60 days of pregnancy. Once we get her to 60 days of pregnancy, it's pretty similar to a young mare out to foaling. And, you know, in my experience, these mares can foal out routinely. And once she has a foal and kind of stretches out that cervix again, these mares actually become really much easier to get in foal in future pregnancies than what they are this first one.
So we have another question from our live audience. It's from Michelle, and it has to do with treating a severe yeast infection in a mare. She says, when treating using a product meant for humans, do you have any thoughts about the effectiveness of a suppository type tablet versus the much messier but higher volume foam? And do you have any thoughts on using grapefruit seed extract as an additive to flush or address yeast or, quote, super infections? Do you have a response for that, Dr. Ferris?
Yeah, yeast type infections can be very difficult to treat. And I would recommend reaching out to a reproductive specialist to come up with a program for treatment for these type of mares. And if it's a recurring yeast infection, I might even recommend, usually we don't get antifungal susceptibility testing done, but there is a lab in Texas at the University of San Antonio Health Science Center that is able to do antifungal susceptibility testing. It's actually a human laboratory, but they will receive veterinary samples for analysis, and that would help you select what antifungal agent you put into the mare's uterus, or potentially even treat her systemically with to help clear this infection. You know, one thing to mention is that a lot of the antifungals are quite expensive for use, but at least if you had that information of what agents would actually be effective against your mare's yeast infection, that hopefully would allow that infection to be cleared. And at least in my experience, if you can add in systemic therapy for 2 to 3 weeks, that seems to really help clear a lot of these infections, especially the recurrent infections in these type of mares. The other thing to be conscientious of with these mares is to really look at them closely and go, why is this mare getting a yeast infection in the first place? Is it due to something with poor perineal conformation, cervical tears, or something like metabolic disease that's suppressing her immune system? So just treating the infection will clear it, but if it's coming back repeatedly, you also have to look at why this mare keeps getting repeated infections, and what can you do to address those other underlying issues, because otherwise you're not going to be successful in your treatment. The question about the grapefruit seed extract, I haven't used it. We did a little bit of work with it in vitro against bacteria when I was at Colorado State University, and didn't see a lot of effect against bacteria. So I don't know if it would work in a yeast organism or not. Oftentimes yeast are much more difficult to kill than bacteria. So since it didn't work well at killing bacteria, I would kind of presume that it wouldn't work well against yeast, but I haven't used it for that particular treatment in my clinical practice.
Okay. So Dr. Ferris, you mentioned metabolic issues possibly being related to yeast infection. So let's go to a question from our live audience that has to do with metabolic issues. Susan says that she planned to breed her Morgan mare in the spring, but she has equine metabolic syndrome. It's been well managed for the past few years, but she did founder this past fall. Is it safe to breed her, and are there any special considerations for a mare who has EMS and a history of laminitis?
Yeah, so it's definitely a hot topic in the equine industry of metabolic disease, and I look at metabolic disease for two kind of standpoints. One, we definitely see mares that have repeated anovulatory follicles, where they grow a follicle and it looks like they're going to ovulate, and then that follicle just kind of degenerates and goes bad. And the sad part is the oocyte never is released from that follicle, so there's no hope of getting that mare pregnant on that particular cycle. It seems like there's at least a weak correlation with metabolic syndrome and anovulatory follicles. So whenever I have a mare with repeated anovulatory follicles, screening them for metabolic disease is one of the top considerations. When those mares are well managed, and it's kind of a difficult question to take over the phone without actually seeing the horse in front of me. It would kind of depend on how severe the laminitis event was and how she's doing following treatment for that. If she's doing really well from it, I think that, it's probably safe to breed her. I always do worry about mares that have a history of laminitis and breeding them to carry their own pregnancy, just due to the fact that they're going to carry an extra 200-300 pounds of body weight and have a cascade of hormones that are rising and falling throughout pregnancy. And it is recognized that sometimes we can see mares that, whether it's due to the change in hormones or the increase in weight that they're bearing on their feet, have a flare of laminitis during pregnancy. So if that was a concern, embryo transfer could potentially be a great option for this mare, and then you don't run the risk of the laminitis concerns in your donor mare, and you could have that embryo transferred into a young, healthy recipient mare. So you still potentially could get foals out of her without running that risk of with the laminitis.
Our next question is from Anne in our live audience, and she says her mare is still young and in year-round training, and her trainer keeps the mare on Regimate. She wants to know if she'll be able to breed her in the future with her having that continual treatment.
Yeah, it's always a concern whenever you put a horse on long-term hormone supplements like that, of is it going to affect her reproductive career in the future? And several studies have looked at that, most of them lasting 2 to 3 years, of putting mares on Regimate for 2 to 3 years and then trying to breed them after stopping the alternogest therapy. And the alternogest is actually cleared from the system pretty quickly. So within 48 to 72 hours, it's going to be completely gone from the system. And your mare should start to grow follicles again and cycle normally, and shouldn't have an issue becoming pregnant in the future, unless she becomes an older maiden mare, in which case then the issue is more just because of her age, and changes to her cervix, not from her being on Regimate or alternogest previously.
Our next question is from our live audience. Emma has an eventing mare who sustained an injury in the fall, and her vet has recommended a lengthy rest period. She says that she's a very nice horse, and she's been toying with the idea of breeding her while she's not working. Could breeding her have any negative impact on the injury recovery, or could her injury hinder her ability to conceive, carry, and deliver a foal?
Did Emma say what her injury was?
She did not, and so we can ask.
So I'll speak globally, I guess, to injuries and stuff like that. For the most part, a lot of these horses that come from an athletic standpoint that have an injury, oftentimes we, because they're going to be on 6 to 8 months of stall rest potentially, and so it's a great time to consider breeding those mares while they kind of have a time period off. And usually they're not going to gain significant weight till about 6 months in foal and beyond. And so by the time you get to that stage of pregnancy, most of the lesions are going to be relatively healed up and able to support that weight gain that's going to happen during pregnancy, and really shouldn't give her any problems for foaling. Probably the only injury that I would say that you may want to talk with your veterinarian about would be for meniscal injuries to the stifle. I know those take a long time to heal. That's what my wife focuses on, is sports medicine, and those can take a long time to heal. And I would worry about maybe that increased weight gain on the stifle potentially aggravating that injury. But for the most part, a lot of suspensory issues and soft tissue issues like that, by the time we get the mare pregnant and get to 6 months in foal, most of those injuries are relatively healed up, and the mare is starting to be rehabbed a little bit to get back to work after the pregnancy.
Okay. And Emma did respond and say that it's a tendon injury that the mare is dealing with. So does that
Yeah, so I would say that, no, I think that's one of those cases that, I'd probably talk to your lameness veterinarian and ask them for sure. But, you know, in my experience, usually if you said, boy, we're just going to start breeding her tomorrow, you know, we're looking at by the time she gets pregnant, it may take a cycle or two. So she's not actually going to be pregnant until mid-February. We're talking about no real significant weight gain till almost August. And so by then I would hope that tendon injury is relatively healed up, and really she's probably starting back into a rehab program at that point, and getting going again. And so I think it would be very safe to consider breeding her.
Okay. We have a question from Sylvia in our live audience, and Sylvia's question is about the working woman mare. She says that she trains and shows a lovely dressage mare. Her owner has mentioned that she would like to get some foals out of her before she gets too old, but the trainer would like to keep her in training, and so would the owner, because she's making such good progress. What's the most efficient way to breed a mare while she's still in training, and how much time would an assisted repro technique take out of the training schedule?
Yeah, so, you know, probably the best option for that mare would be to consider embryo transfer, because that would allow you to collect an embryo, transfer it into a surrogate. The surrogate carries the pregnancy, and your donor mare can go right back to competition. Usually, the quickest it can happen is about 2 weeks. So it gives us about a week to follow the mare, get her inseminated, get her bred. And then roughly 7 or 8 days after ovulation, the embryo recovery will be performed. So sometimes for my clients that have horses in competition, we'll try to pick various time points throughout the summer or spring when there's 2 to 3 weeks off in between shows that we can go ahead and work on her and recover embryos out of her. If they said, boy, we're just going to take her out of training completely during this time period and elect to do it, I normally tell a client that it could take 4 to 6 weeks, just so that way it gives us a couple. Not every mare is going to get pregnant every cycle, and so that gives us an opportunity to work with her, get the embryo out, and hopefully it happens much faster than 4 to 6 weeks. But at least that sets everybody up for success, and we can send her back to competition a little sooner than we anticipated.
Okay.
The only caveat with that I would add is that just remember that older maiden mare syndrome is that, you know, it would be lovely if mares could carry a foal to term sometime, you know, 10 to 12 years of age, because that's going to really set her up for being able to be successful in her later teens and whatnot, maybe when she retires from her competition career.
So Dr. Ferris, 10 to 12 is right about the time that mare will be doing Grand Prix.
Of course, I know, right? You know, that's everybody's standpoint. And I guess thinking about that, if you breed warm bloods and whatnot, a great time, and oftentimes this is what's done in Europe, is when they're 3 or 4 and just starting under light work and maybe not even under light work yet, it's a great time to consider letting them have a foal at that age. And then that will buy you many more years. So that way, when they are going Grand Prix, you can just pull embryos from that mare and not worry about the older maiden mare issues that could pop up.
Okay. Her next question is from Jane in our live audience. She said that she had a mare reject her foal last year, and she's going back and forth on whether or not to try breeding the mare again. Do mares ever figure it out if they tried to hurt their first foals?
So the foal rejection, fortunately, is not very common in the equine realm. And, you know, we see it more commonly in Arabian mares and mares that have rejected a foal previously. There's a higher rate for future rejection as well. It's not 100% of mares, but it is higher as compared to a mare that accepted her foal. Most of the time, you won't have that mare have a foal rejection in the future. So it is something that, you know, it could happen again for sure, you know, but it's a less likelihood to happen again. And I guess the things to think about is, did that mare ever accept her foal at any point, or was it completely, absolutely no, I want nothing to do with this thing? And if that was the answer, I'd probably, you know, maybe lean towards not trying to let her carry a foal, or at least be anticipating that she may reject that foal again in the future. And so unfortunately, some of those mares just are not meant to be brood mares.
Our next question is from Hannah, and in our live audience, and it's a stallion-related question. She wants to know if there is a prime time or age range when a stallion's fertility is at its peak. When selecting a stallion to breed your mare to, should age be a factor in that stallion?
Yes and no. You know, I mean, peak fertility in stallions kind of matches about that of a mare, and that, you know, fertility rates stay quite high till they're, you know, 12 to 15 years of age, and then will start to go down just a little bit as they enter into their mid-teens, and then drop again when they get over 20. And so I think oftentimes I think of, you know, what is the combination of the stallion and the mare you're trying to breed. The hard part is that oftentimes the really great stallions that have been proven to have successful offspring and competition, they oftentimes are older stallions. So if you're breeding an older stallion, I would encourage you to pick a younger mare, because they're going to be more fertile than an older mare. And so that way, hopefully you can help overcome some of that slight drop in fertility. The worst combination I like to get is the mare that's 22 and the stallion that's 23, and hoping to get a pregnancy or an embryo out of, you know, if I have an older mare, I'd oftentimes ask, you know, can we pick a younger stallion that's somewhere 6 to 15 years of age that, you know, might have a little better fertility. And as with all things, fertility is a completely individual event. And so there's definitely stallions out there that are in their 20s that have fantastic fertility. And there's stallions out there in their 20s that, yeah, things are not working as well as what they did when they were 10 or 12. So I think, you know, asking the owner of the stallion that you're considering, a great question or a fair question is, how many mares did you breed in this last breeding season or two? And how many mares were pregnant at the end of the season? And, you know, another question that goes along with that is, how many shipments did it take to obtain that pregnancy on average? I think those numbers there can really help guide you of, do you want to pick that stallion or not?
We have another question from our live audience. Gretchen says that she's heard that she needs to have a breeding soundness exam done on her mare before she breeds her. What is involved in a breeding soundness exam, and what should her vet be looking for?
It's a complicated question, and I think it depends on a little bit of the mare. You know, a very basic breeding soundness exam would be a thorough ultrasound exam looking for any abnormalities, evaluation of the perineal conformation, potentially a speculum exam if needed, to evaluate the cervix and cranial vaginal vault, and then a culture and cytology of the mare's uterus. And really that culture and cytology is to look for any infectious or inflammatory conditions that could be present in the mare's uterus. That would probably be the initial breeding soundness exam for a lot of mares. For mares that have a history of not getting pregnant, an endometrial biopsy may be warranted in those mares, where they take a biopsy instrument and get a little snip of the endometrium. They send that into a laboratory where they look at tissue under a microscope and give us an idea of the status of the endometrium, and how much inflammation and fibrosis is in that mare's uterus, and give us some expectations for issues that we may have during the upcoming breeding season, and what's the odds of getting that mare pregnant and getting her to be able to carry that foal all the way to term.
Our next question is from Sarah in our live audience. Sarah says that she has a mare with suspected placentitis, currently at 292 days and on SMZs and Regimate. She said that they want to check cervix, I'm having a hard time reading this question. The cervix prior to another breeding, when would be an appropriate time? Can this be done at a stage of pregnancy, being that she is on Regimate, or do we wait until after foaling? I don't know if I did that question justice reading it, Dr. Ferris, but do you have enough information there?
Potentially. So I think anytime you have a mare with placentitis, you know, usually I don't do a lot of reproductive evaluations of those mares at that time. I worry about supporting that pregnancy and hopefully getting that pregnancy to go all the way to term and getting a live foal on the ground. Definitely, I typically don't recommend breeding those mares on full heat after having placentitis, giving them and letting them come back on their 30-day heat, and looking at them at that point. In between that time frame, probably 20-25 days after foaling would be a great time to assess that mare and look at her. The critical things I'd be looking at is her perineal conformation. Does this mare need a calf slick or other procedure to try to reduce our risk of placentitis in the future? And definitely evaluating that mare's cervix to see if there was some sort of explanation or the cervix was involved in causing the initial placentitis case that you're undergoing right now. And so normally I'd like the mare to be in diestrus or have ovulated and be under the influence of progesterone during that examination, because its cervix should be nice and tight and closed. And what I'm really trying to evaluate is what that cervix would be like while that mare is potentially pregnant, and try to get an idea of is there any adhesions or cervical tears or abnormalities to the cervix that could explain why this mare got placentitis.
Okay. Our next question is from Beth in our live audience. She wants to know if back issues or spine issues, such as kissing spines or SI joint issues, make it more difficult or painful for a mare to carry a foal.
It's a great question. I have managed several mares like that, and usually they seem to do pretty well, carrying a foal to term, and it definitely is going to depend on how severe the case is and things like that. But usually the ones that I've been around, they do pretty well. They're able to carry their foal to term. I'm always a little concerned with some of the mares with severe SI pain or kissing spines of, are they going to be able to have normal uterine contractions and the real strong abdominal press to help push that foal out? But I haven't noticed any differences in those mares as compared to a mare that doesn't have back issues. So I don't think it should preclude you from considering breeding that mare.
Okay. We have a question in our live audience from Sarah. She said that she is shipping semen to a client. A few years ago, the mare was unknowingly exposed to creeping red fescue for a lengthy period of time. The mare has been covered several times by a different stallion with no luck in a pregnancy. Is there any correlation between creeping red fescue and long-term damage to the uterus? The mare has been biopsied and checked. Culture and cytology are clean, yet there's still no foal.
Yeah, off the top of my head, I'd probably have to do a literature search on creeping red fescue specifically, but with fescue in general, Dr. Jim Brindamule did a series of studies early on and saw that fescue grass, and really with it, it's the endophyte infected fescue. And so I'm not sure if red creeping fescue can become endophyte infected or not. In mares that were fed endophyte infected fescue, they did show a lowering of pregnancy rates. But once you took those mares off endophyte infected fescue, they had normal pregnancy rates and whatnot following that. So I think just exposure to it previously, I don't think that's probably the source of your subfertility, and probably need a detailed workup in that mare to really figure out what's causing her subfertility.
Yeah, and I just finished this week a review with an expert in fescue toxicosis about that specifically for a download that we just released, that Jennifer, our web producer, can put the link in the chat for Sarah if she wants to read it. My understanding from that, and I'm definitely not an expert in this, but that it's specific to tall fescue, and I don't know enough about grasses to know whether or not creeping red fescue is classified as one of those tall fescues or not. But Jennifer will pop that URL in the chat, and hopefully that can get Sarah some information, and we can look more into that because it's an interesting question. I find the fescue toxicosis is very interesting and confusing to me. So
yeah, I agree.
yeah.
Michelle, can I make one more comment here?
Yes.
As I'm giving all these recommendations of saying, yes, you should breed your mare or should not breed your mare and whatnot, you know, I think one of the key parts to having a successful breeding season is really to have that team available to you of who's going to help you get this mare pregnant. And, you know, I mean, I think my recommendations are kind of the global 40,000 foot view average case with this, but, you know, definitely having that conversation with who's going to help you get that mare pregnant and really walk through the situation at hand, because definitely that opinion could change, and my opinion might change if the mare was actually standing in front of me. And then the other part of the successful team is who's going to help you take care of that mare during pregnancy and making sure she's up to date on her vaccines and any issues that could arise during pregnancy, and then making sure you have that successful team for the actual foaling process of, are you going to foal the mare out at home? Are you going to take her to a center? Where's that at? When are you going to bring the foal home? Do you have the facilities set up to take care of that foal once she gets home? And as the question popped up earlier, you know, having a foal in January where it can be colder and those type of situations, you know, just spend a little bit of time now before the breeding season really gets kicked off to plan out, if you're a new breeder, of who that person is and what your team's going to look like to optimize your success.
And Dr. Ferris, you mentioned vaccination for pregnant mares, and we did receive questions about vaccinating prior to pregnancy, but can you talk to us a little bit about what the recommendations are for vaccinating a mare during her pregnancy and why that's important for the foal's health once it's born?
Sure. So there's two basic kind of timelines for vaccination in the pregnant mare. One is a series of vaccines against equine herpes virus, and that's to prevent equine herpes virus abortion. And so we typically administer those vaccines at 5, 7, and 9 months. And so that's to help protect the mare in case she got exposed to equine herpes virus from having an abortion due to that. And then at 10 months in foal, we almost give the mare her spring shot series, if you will. Oftentimes this is a 6-way vaccination. And the goal of this vaccine, so I'm going to pick on a mare that, let's say you have a mare due January 15th. December 15th, she's going to essentially get her spring shot series that she might get in April or May. And the reason we give that vaccination in December is that it's going to boost the antibody levels in her blood. And just prior to foaling, she's going to start to produce colostrum, where she pulls the antibodies out of her bloodstream and concentrates them in the colostrum. That foal is going to nurse that colostrum and absorb those antibodies that are from the mare, and that's what's going to protect that foal from developing those diseases for the first several months of life. And a website that has great details of exactly good protocols and whatnot. Potentially somebody could post the URL. The American Association of Equine Practitioners have great tables for recommendations for vaccinating the pregnant mare and even the foal. And they're pretty straightforward and something that you can download right off the website.
Okay. Our next question is from our live audience. It's from Leah. She said that her mare colicked last year when she was pregnant. Fortunately, she recovered with no further issues, but it made her think, can pregnant mares have colic surgery, and are there risks for the mare or foal?
Yes, pregnant mares can have colic surgery. It always does worry us a little bit of putting a mare under general anesthesia, and especially for depending on the reason of why they're colicking and what the surgical issue is. You know, the severe endotoxemia that oftentimes is associated with colic. We do worry about the effects of that endotoxemia on the pregnancy and the ability to maintain that pregnancy. To help overcome that, your veterinary team, when you take her in for if your mare did have to go to colic surgery while pregnant, oftentimes we'll put your mare on a double dose of Regimate. So usually Regimate or Altrinogest is administered at 1 ml per 100 pounds. And so in this case, to help maintain pregnancy during a endotoxic event or colic event, they may put that mare on a double dose, so 2 ml per 100 pounds of Regimate or Altrinogest to help support that pregnancy. And at least in several models of endotoxemia, the double dose of Altrinogest is much more readily able to maintain that pregnancy as compared to a single dose of Regimate daily.
Our next question is from our live audience. Tina says that you mentioned the Catholic procedure earlier. She wants to know what that is and what it's for.
Sure. So in a normal mare, her vulva should be perpendicular to the ground, so perfectly upright. And it should have good tone. So if you went up to your mare's vulva, no one does this but reproduction guys like me. I wouldn't expect any of you, the horse owners at home, to ever go do this. But if you try to just open the lips of her vulva, it should be pretty difficult to actually part her vulva. In mares with poor perineal conformation, so this would be where there's a tilting of the vulva, and the classic breed that's talked about with poor perineal conformation is a thoroughbred. With that, to correct some of that deformity, we make a surgical incision along the edges of the vulva and actually suture the top 50 to 60% of the vulva closed. And so what that does is keep the vulva kind of sealed tightly and prevents the mare from having excessive bacterial exposure up into her vaginal vault, or air getting up into her vaginal vault, causing irritation and potentially causing placentitis, or even preventing the mare from becoming pregnant even initially. So I'm sitting here waving my hands trying to draw a Catholic or a vulva to show you how to do this. But I'm sure if you Googled how to do a Catholic, there may be a YouTube video kind of illustrating how it's done. And whatnot. We do use lidocaine during all these procedures, and so the mares are blocked, and so hopefully they can't feel the procedure. And definitely working in the back end of a mare, I always like to make sure that they're very well blocked, because my life is kind of in that mare's hands at that point as we're doing the procedure. But yes, it's a relatively quick thing, and and it really can help restore fertility in some of these mares with a history of poor fertility.
So, Dr. Ferris, I just recently got a 4-year-old mare off the track. She's a thoroughbred, and she had an eye injury, so she was sedated. So while she was sedated, my vet did a full just once over on her and discovered that she had a Catholic, and that there weren't any sutures there, but she's grown together. And so that's something that I've never had a mare that's had that done before. So I was surprised that she was grown together. I didn't realize that happened, and that the sutures would dissolve, I guess, unless they were removed. But why is that done on thoroughbreds that haven't been bred? And should I be concerned about her being grown together? Will that impact her future potential as a brood mare?
Yeah, great question. So I guess I should have explained that with the Catholic procedure, we actually, because it's a surgical incision and we actually suture the tissue together, it actually heals together. And we either use absorbable sutures, in which case they don't have to be removed, or non-absorbable sutures, in which case in about 2 weeks we'll come back and remove those sutures. In a young mare, especially in a thoroughbred racing mare, oftentimes a Catholic is put in when they're roughly 2 years of age and heading off to training. And the reason for that is that it's well known in thoroughbreds, they have poor perineal conformation and oftentimes poor vulvar tone. So just when they're walking or being exercised, sometimes you can hear these mares aspirating air up into their vaginal vault. And it's thought that, at least in some of these mares, that aspirating the air up into their vaginal vault can be quite uncomfortable for them. And because of that, we put a Catholic in them, and then that prevents them from aspirating air up into their vaginal vault and causing that discomfort during training. As far as being a broodmare in the future, it doesn't preclude her from being a broodmare, and oftentimes we won't even remove that Catholic to go ahead and initially get her pregnant unless she's going to be live covered. And usually the general recommendation is about 30 days prior to foaling. So oftentimes when we give the 10-month vaccinations, we go ahead and remove that Catholic. We reblock the area with some lidocaine, and with a simple pair of scissors, just open up the Catholic, and then that allows the mare to foal out uneventfully.
Okay. Well, thank you for explaining that, because it was an emergency situation with the eye injury, so I didn't get into asking questions about it, but I was definitely surprised when the vet, I was following her around as she's doing it, and I was like, hey, that doesn't look right. So she's like, no, it's fine. And then we moved on to the eye. So anyway, interesting. So our next question is from our live audience. It's from Jeanette, and she has a 15-year-old retired endurance mare that has ring bone. She gets equiox every day. She'd like to breed the mare, but is wondering if the NSAID is safe for a pregnant mare.
Yeah. It seems to be, it doesn't have a label claim for use during breeding or pregnancy per se. I've managed several mares that have been on equiox and haven't noticed any adverse events. And Dr. Margot McPherson at the University of Florida has actually, as part of the placentitis model, has added equiox into the various medications that we give. And it seems like equiox can really be helpful in placentitis cases. So it seems like it's very safe to use during pregnancy and really has no adverse events. So I would be fine having her on equiox during that time frame. There's a little bit of literature out there, if you look, that some of the COX-2 selective agents like equiox may inhibit ovulation. A study that we did just before I left CSU, we put a bunch of horses on equiox trying to see if it would inhibit ovulation, and we noted no increased incidence of failure to ovulate in mares on equiox versus those not on equiox. So if that keeps her comfortable, I'd rather have her comfortable and be lameness free than taking her off the equiox for breeding for sure.
So Dr. Ferris, we've talked about mares being too old for breeding, but we have a question from our live audience from Bob, who wants to know how young is too young to breed a mare. I would say that when a mare is 3, they're usually quite mature and whatnot, and very safe to go ahead and breed. 2-year-olds, oftentimes they're just not mature enough, and sometimes you may stunt their growth a little bit and their development if you go ahead and try to breed a 2-year-old. If it's later in the year, like if you have a mare that was actually born in January and by June or July of her 2-year-old year, she's probably old enough to go ahead and try to breed. But a mare that, I'll pick on another mare, a mare born in May, in her 2-year-old year, she's probably just not old enough to really consider breeding, and you're probably going to be better off waiting until she's 3 years of age to start your breeding program. We have a question from our live audience from Nora, and Nora says that she's heard that C-sections are risky for mare and foal. Is this true, and why?
So yes and no is the complicated part. C-sections are pretty rare in the horse as compared to, I'll pick on humans, where they're relatively commonly performed. And oftentimes when we do a C-section in a mare, it's for a dystocia, or where the foal isn't able to, is in an abnormal position and isn't able to pass through the birth canal. Fortunately, mares with severe dystocias that might require a C-section only happens in about 2% of foalings. So it's not very common. And usually by the time that the dystocia is recognized and the mare gets to a referral center where a C-section is possible, oftentimes that foal is not going to be able to be saved. And kind of the data out there, once the mare breaks her water, you kind of have this golden period of time for 30 minutes where there's no real decrease in survivability of that foal. After 30 minutes, every 10 minutes, there's a 10% reduction in foal survival. So that's oftentimes where in a severe dystocia that might warrant a C-section, oftentimes the foal survival isn't going to be as good. For the mare, usually most of these mares do quite well following a C-section, and those mares, you know, the morbidity and mortality is actually quite low in mares that have a C-section. They do pretty well. They wake up from anesthesia really well, and they can do quite well. And really, you shouldn't let that C-section necessarily preclude you from breeding her in the future. Obviously, you're going to have to let things heal for a little bit, but a lot of those mares continue to go on to be very successful brood mares after having a C-section.
Okay. Well, that hour went by really fast, Dr. Ferris.
Yes, it did.
Yeah. Unfortunately, we are out of time, but I want to thank everyone. We had some really great live questions and interaction, so thank you for everyone who is listening live and sending in questions. Also, thank you, Dr. Ferris, for joining us and answering these questions. Your answers have been really great and helpful. It's been very interesting.
Yeah, thank you for all the great questions and discussion tonight. It was a lot of fun, and this hour flew by. It seems like we just started the discussion.
Yeah, and we probably have a lot of ground that we could have covered that we didn't get to as well. So anyway, thank you everyone for joining us. If you have more questions about breeding, you can go to thehorse.com and check it out. Also, Dr. Ferris has offered to answer any follow-up questions that you might have. So when you get your follow-up to this event, if you have any burning questions that didn't get answered, go ahead and send those to us, and we'll see if we can take some of Dr. Ferris's time. I think he offered that, though, right before foaling and breeding season, so we'll see how much time we can get out of you.
Right. Sounds good.
Yeah. So again, thank you to everyone. I hope you can join us next month. We're going to be talking about equine infectious anemia. Until then, from all of us at The Horse, we hope you have a great night.